Good afternoon, ladies and gentlemen. If I could have your attention, please, just for some general safety announcements before the meeting commences. I'd just like you to take note of the emergency exits. There are 2 emergency exits at the rear of the room, and then there's another emergency exit behind me. There are members of staff of the policing authority here today, so if you do need any assistance, if you can approach them, they're in the room and outside the room. As you will be aware, this is a live streamed event on the internet, and a video recording will be made of the meeting for online broadcast. And in that context, if I could just bring 2 things to your attention. Firstly, can you please ensure that your mobile phone is switched off or that it's set to airplane mode, as it can affect the live streaming and the sound. And also you should be aware that anyone present may appear as part of that record. We would ask you to observe silence at all times, please. And if you do need to leave the room, if you can do so as quietly as possible. And the final thing that I would like to bring to your attention is that, as usual, today is an engagement between the authority and the Garda Commissioner. You're here in an observation capacity only. There will be no opportunity for anyone other than the authority and Garda representatives to participate in the meeting. Thank you very much.
Díomh a chuirde agus fáilteóibh go dtí an cruinniú seo den údras Pólíneas a cruinniú poiblí leis Commissioner agus a chomhlachtaithe an cruinniú dearnach poiblí den bhliain seo agus sin I gceartláir na tíre I Bord Líse áit a raibh deise going inné cuairte thuairt ceann Cairú an Garda Síochána san Ryan seo. You're welcome, everybody, to this meeting of the Policing Authority, held in public as the statute requires, and this is the final meeting in public this year with the Commissioner and his colleagues. We're meeting in Portlaoise as part of the authorities' reactivated desire to be present around the country after the exigencies of the pandemic period, when such ventures were either impossible or would have represented an excessive demand on an already very stretched Garda Síochána. And we had the opportunity yesterday to meet with the division officer, Chief Superintendent Scanlon, and some of his colleagues here in Portlaoise, and to discuss with and hear from him about the priorities and the challenges and the achievements of policing in this part of the country. And a range of the topics that we will be discussing today with the Commissioner and his colleagues, although with a national focus, have a resonance in this division as they would in any division in the country. And perhaps, Commissioner, I might ask, first of all, Chief Superintendent Scanlon, after any introductory remarks you want to make, to ask Chief Superintendent Scanlon to say a few things to us about the strategic challenges, the nature of this division, and the focus of his and his colleagues' policing efforts. But over to you, first of all.
Thank you very much, Chair. And if I just might take 2 minutes, I was very grateful for the support that the authority demonstrated towards Garda Síochána following the incident on Sunday night. I can't go into that to any great extent. Obviously, there's 4 individuals before the courts, but I have obviously spoken with the 2 members who were injured and who are in good spirits and making a recovery, and we wish them all the very best and a speedy recovery in that. I think it's regrettable that for 2 public meetings in a row now we are speaking about incidents where there have been attacks on Gardaí. Some of it has obviously reached the public consciousness through social media, but it is a reality for members of Garda Síochána. But also then I'd want to assure the public, but also primarily assure the Garda workforce that their safety, their health and safety in work, the equipment that they have to protect themselves are all very integral to our ongoing discussions and management discussions to make sure that we provide them the very best of safety equipment and do all we can to make sure that their workplace is safe and sound. But even then, beyond that, then I would also say that there are no-go areas for there isn't any no-go areas for Gardaí. We are accepted in every community. We work hard with every community. We have a community policing strategy that is live and is being implemented, and there's great results from that, and that's coupled then at a local level with our action against drugs and local drug dealing. And we are addressing problems that communities have identified, but we know ourselves that we have to reach out all the time and want to be seen as a policing service is serving everyone and doing its very best to protect everyone as well. And we work hard at that, but part of that is also then a police service that can protect itself as well. And takes me back to my original comments. We always consider the welfare and safety of our members and make sure they're appropriately equipped. Thank you.
Thank you, Commissioner. As I said at the earlier meeting in private, if there were any incidents that illustrate the risk to which Garda members place themselves on a continuing basis when they go on duty, it was two entirely different kinds of separate, unrelated incidents. One where a guard comes to the assistance of somebody who needs assistance at the roadside and then is the victim of a road collision with significant impacts on him, and then the incident to which you referred and which we spoke about earlier. It illustrates as I say, the risks to which Gardaí willingly present themselves on a continuing basis as they go about their work, as they embark on their duty, so that the rest of us can live in safety and in the confidence that the Gardaí are engaged in that way with communities. And what you say is absolutely right and resonates with everybody who will listen to you, who will hear your words. The authority has consistently, from the beginning since its establishment, condemned utterly all incidents of violence against Gardaí, none of which can ever be justified in any way. No amount of rationalisation can clear the responsibility for any attacks on members of the Garda Síochána who are doing their duty. And your words of support for Garda members is entirely echoed by the authorities' support for what is being done by the organisation in support of its members in these circumstances. The challenges that arise are not confined to any particular part of the country, as you say. Issues arise throughout the country, and we're acutely conscious of that reality in the lives of police officers in this state. And we wish early recovery to all of those who have been affected in any way, and we will continue to engage with you, Commissioner, and your colleagues in relation to these issues and in relation to the service that's provided by the Garda Síochána to the community. Turning to the first item that we had on this agenda for the public meeting, local policing challenges in this division. Maybe Chief Superintendent Scanlon might make some brief observation to us on the challenges and the opportunities and the work of his colleagues in this division.
Thank you, Chair. Thank you, members of the authority, and thank you for a very useful engagement with our staff yesterday at Portlaoise. It was a source of encouragement to my people on the ground that they met the authority, and thank you for coming to the station. I suppose you saw the realities of what it is to be in a Garda station in a place like Portlaoise. Portlaoise is the divisional headquarters for what will be, under the op model, the new division of Laois, Offaly and Kildare. It is the largest, most populous division in the state by some 50,000 people. The nearest next most populous division to me is DMR North, with some 50,000 less people. It caters for 40 Garda stations. A lot of them are in quite poor condition from a building point of view, but from a human capital point of view, with the members that are working there, I'm quite proud to sit here as I finish up in the next couple of months, having done 41 years service with Garda Síochána. I'm quite happy to sit in front of you here today and talk about those challenges these members face. We face challenges of being very close to the urban area of Dublin and more or less almost interface with Dublin in parts of North Kildare. There's actually possibly a net migration into Kildare from an employment point of view, like some 20,000 people attend at the Intel site. But to deliver a service to them, we opened a Garda office within the Intel complex to provide that place where people are at work during the day, when it can often be difficult to make contact with Garda in the evening for even the most simplest of tasks like signing passports. All the way down to the Slieve Bloom Mountains. And as I arrive in the Slieve Bloom Mountains, I remind myself of last weekend when we went there to honour the death of the first guard who was shot in the line of duty in the state, as the Commissioner has referred to people being injured. But we started out in our service losing the first person to lose his life in the Civil War was Henry Phelan. He lost his life in Mullinahone in County Tipperary buying hurleys to set up a hurling team in Callan in County Kilkenny. Those virtues of community involvement are sustained to this day, and I outlined to you yesterday. We didn't actually go around the room and canvass it yesterday, but every member of sworn staff that was sitting in front of you yesterday is participating in a club or a community group or a chair of or involved with a board of management of a school. So where we garner our public support is that our interface doesn't stop with the clock stopping our day's work. It continues out into our daily lives as participants in the community. And we're as much invested in this division in keeping our people safe as we are in the workplace. We have some 40 Garda stations, as I said to you. Our challenge is that most members, the ratio of investigations to members, each member is, on average is carrying about 24 investigations at any one time. In my time in service in Garda Síochána, the landscape of how and we deal with people has changed, but the basic tenet of common sense and decency should still be the central tenet of how we approach people and how we hopefully give a service to people. Ours is a victim-centred service, and we set out to you yesterday on an example which I can't go into in any great detail because of the public nature of this meeting, of how we support people beyond the mechanical means of domestic violence, where we have in some instances assigned community Gardaí to go back and keep going back to people to ensure that they can rely on the support of Garda Síochána if they have a complaint to make. I have now seen a greater infiltration of Garda staff. I don't have any guards left in Garda stations that can be released, and I think I walked you around the offices yesterday and I made one observation to one of you, which said, they said if you can find any guards in offices, I'll release them. I might be more correctly put to you, if you can find an office that we have vacant, I'll say, well, I'll put someone into that, be it a guard or a Garda staff member. We are extremely challenged in the accommodation that we have available in this division to provide the policing service that should and must be expected of us in the 21st century. I have two major emergency areas in this division, and we service 3 JPCs. In those JPCs, we hear from the local representatives and some elements of the community as to the service needs of them, and we interface with them. However, going forward and beyond that, we also engage with a number of the NGOs in the area. I myself sit on the board of Laois Domestic Violence, and we remain challenged there insofar as that we have no domestic violence refuge for people who are victims of domestic violence in this county. It is under development, and I want to acknowledge the support of the local authority in providing a potential site for this, and indeed from the community itself in raising funds to support those people. As I say, I'm open to questions really at this stage from the authority. That really is the landscape of where I am. We go from an extremely rural environment to almost the urban part of Dublin City to provide a policing service in this division. As I say, it is over 5,500 square kilometres with 40 Garda stations, which differs from Dublin, where they would have the same penetration of population, but they would be servicing 6 stations. So when I start cutting the cake of resources, I have 40 rooms to fill, and that's only given 1 to each room. I have some 898 resources all told, 1,818 Garda personnel and 80 Garda staff. So that's the profile of where we are here today. Thank you, Chair.
Thank you, Chief Superintendent Scanlon, which gives those who are watching or listening to this a sense of the scale of the division, but also a sense of the variety that characterises the work that is done. And I wonder, Commissioner, whether there is anything that you want to say, perhaps specifically about this area, but also about the significance of local policing and the issues that arise for divisional officers throughout the state in this respect, before opening up to other colleagues.
I think the point that's really apparent here and apparent in other divisions is the connection between Gardaí and the local community. I think that's a real strength, and it's particularly prevalent here in the rural communities where there is that connection. A lot of it, I think, is driven by the 40-odd stations. So not just the big stations, and the temptation there might be to brigade your resources, but also then by the smaller rural stations. And I think that's something for the future. We have an increasing population that will also lead to increased requirement for Gardaí. So we are a growing workforce, and over the next 10 or 15 years one can see that growing considerably. So I think it is to our benefit that we have this expansive estate to provide services to what will be, we would envisage, growing towns and villages, particularly in an area such as this, which is profiled to grow very significantly in terms of population. And we see that in other places in terms of Meath and Louth as well. So we have to prepare for that in terms of building and personnel. But this is all built on our connection with the community and the delivery of a policing service that meets the community's needs. On Monday I was in Louth, and for instance, the community policing team in Drogheda received an award for their connection in terms of community policing into areas which had been badly impacted by the ongoing drug gang feud that had been prevalent there 2018, 2019 into 2020. And so that's what we want to build on. We want to build on those strengths. We want to build on the strength of that connection and the public confidence which is demonstrated in Garda Síochána. Thank you.
Thank you, Commissioner. And is I suppose it's no longer a phenomenon, it's just a continuing reality of the increasing urbanisation of previously rural or small town parts. Is that a complication? Well, is it a complication in itself, and is it one that is replicated throughout the state? And does it pose a particular challenge for you in the deployment of resources and in the management of the policing of local communities?
Well, in so much, if I don't do the preparatory work now, my successor in 10 years' time or 15 years' time will have a lot of difficulty, because I need to make sure that, one, the infrastructure is in the right place to support that. But that's evident from the development plans that we can see around where population growth is likely to be centred on. That's what drove a lot of our 10-year capital plan in terms of preparing for that. So that's not just about Dublin. Other cities and centres of population are also going to expand as well, and what our villages will become small towns, what our hamlets will be villages then, and we obviously want to maintain this close contact. We have a model of policing which it certainly is now unique in these islands. It might have been at one time everywhere on the method of policing, but it's now unique to this state, and it brings, I think, real advantages to us in terms of public confidence and public connectivity, and we certainly don't want to lose that going forward into the next 2 decades. So there's preparatory work for me in terms of recognising what will be the policing service we provide in 10 and 20 years, and trying to put in place now the building blocks. And we can see just what the expansion of population is going to be, and that's going to be a challenge for all public services. And the quicker we make the preparatory work, put the foundations in place, then the better.
Any of my colleagues, Moling.
Yeah, if I might address a question to the Chief Superintendent, and one of the issues that the authority has been engaged with for quite some time, and that we've addressed in public fora, is the whole issue of drugs and the impact of drugs on communities. And the question to the Chief Superintendent is the extent to which this is consistent with his experience in this division, and what type of challenges is he facing, and what sort of responses has he sought to put in place?
So, drugs pervades all of the country at this stage. My history was I started out in Dublin. I worked in a drugs unit in the north side of Dublin City some 40 years ago, and drug deaths became the currency of heroin abuse in inner city Dublin, and almost did untold damage. We are now witnessing significant quantities of drugs being distributed across all stratas of society, almost a risk of normalization of it. I did describe some events to you yesterday which really bring home the message of how penetrated it is in our society. So we have a couple of challenges arising from that. I police an event here called Electric Picnic, which is probably familiar to everyone that's watching or listening, or indeed yourselves. It is a music festival. So the health authorities have brought to that table the idea of testing the veracity of some of the drugs that some of the people are using at these festivals. It represents a significant risk to their health. If I was coming here 20 years ago, I wouldn't have a drugs unit. I now have a drugs unit and an architecture around a drugs unit that looks like I'll have a sergeant and 5 in each area, 2 and 10. Probably 4 sergeants and 20 guards is my ambition for the drugs unit policing response to it. Secondary responses then is we are engaging with families who are subject to drugs intimidation because elements of their family have run up drug debts with significant criminal cohorts. They are being supported. Within that, you would be an ostrich putting your head in the sand if you didn't acknowledge that there was significant challenges around drugs, particularly cocaine and those type of drugs in our areas. We have made significant arrests around interdicting large-scale volume drug dealing, and that, but there is, and we also have a challenge on our roads in terms of 50% of our detections for intoxicated driving is now drugs. I think it lays down a challenge to us all. It pervades all sections of our society. It's not just, once upon a time it was lower socioeconomic Ireland was using drugs that were threatening their lives. Now all sections of society are at risk from it. So we do acknowledge that, and that's where the policing response is in this division. Thank you.
Yeah, again, maybe just for the Chief Superintendent and maybe for the Commissioner as well, but when we've done these visits to different areas, one of the challenges that is often described to us, both by the guards that we visit, but also some of the local community groups, is the extent to which local communities who maybe have a slightly difficult relationship with the police can feed back concerns to local Garda officers. And I know that you mentioned in your opening remarks, Chief Superintendent, the JPC, or the 3 JPCs that I think you said you have responsibility for, and that's obviously one mechanism of trying to allow a sort of feedback loop, if you like, to the police. But I wonder if you could say a bit more about any sort of mechanisms that exist or any structures that exist below that. So perhaps particularly picking up concerns that might arise in communities that are beset by drugs and by antisocial behaviour, etc. Because again, that I think is a pattern that we have seen in other areas, that's a very difficult relationship sometimes, and it's not easy necessarily for local police to pick up those particular concerns. I think you did tell us a little bit about that yesterday, but I wonder, might you just say a little bit more about that?
Obviously, if the people are involved in using drugs and they're being intimidated, there are several lines into that equation. One of them is our community guards, who are interfacing with NGO agencies that are here, youth groups, schools programs. We have many outreach ways of reaching to people, and that can even take it that because we're so embedded in our communities, that for me actually worked out at 2 or 3 people coming to my personal front door and discussing with me, as knowing I'm to be a guard, forget about the rank I held, they just knew me as a guard as far as they were concerned, the potential that they might have concerns in their own family home of a child using drugs. So drugs are so pervasive across society now that our lines of communication to people are many and varied. If you talk about challenged urban communities, the urban centres that exist here in Laois essentially revolve around three potential areas in Laois itself, if we take it, where we would have concerns, significant concerns. So number one is a policing response, straight up trying to interdict suppliers. Number two is trying to support people who are using drugs. I suppose one of the things that the pandemic threw up to me in the policing challenge was that most people had disappeared off public transport, except 2 cohorts of society. One was addicts making their way to drugs treatment clinics in Dublin, and the other was unfortunate people who required acute health care making their way to Dublin hospitals to receive perhaps cancer treatment. So into that equation, we found ourselves in difficult policing circumstances on the trains, so we ended up putting guards onto the trains. So we have many and varied interactions with society, straight from the raw, hard-nosed interdiction of drugs, as it is a criminal currency within the architecture of it, straight through to the welfare piece. And to bring you into the electric picnic piece then, we spoke with we've had extensive relationships with the promoter there. And when I arrived here first 10 years ago, people were essentially just excluded from the event, and that was it. And if they were acutely ill, okay, there was treatment. We brought in another process into the event, which was a welfare tent, where where young people who were not worse for wear to the extent that they'd need medical assistance, but probably were being evicted from the process, would be brought to a welfare scenario. So that builds itself into every possible policing response that we can bring to bear. I just cannot overemphasize how pervasive drugs is in our society at the moment. So I don't know whether that answers your question correctly or not, but that's my sense of it.
Well, I wonder, Commissioner, might you want to come in relation to this as well? I suppose, and thank you for that answer, Chief Superintendent. I suppose what I'm asking is, are you assured, both at a regional level in this division and across the country, that concerns that those local communities have, and we talked about some of them earlier on, are brought appropriately to the police's attention, and that the response from the guards to concerns of local communities in what might be termed hard to reach areas is speedy and appropriate?
I think just beyond what John has been outlining, I would just outline just or set out the very extensive connection that we have with the community, and I think, as already been mentioned, our juvenile liaison officers, our schools programme, our community policing teams, and then the connection we have with elected representatives, and the connection then we will have them with local bodies, be they statutory in terms of local authority, but also then the NGO. So there's a whole range of connections out to the community that's being served in terms of them providing feedback, but also then the extensive connection or the extensive interaction that we have, particularly with victims of crimes such as domestic abuse. And there's a lot of feedback comes through there in terms of just, well, one, the service we provide, but two, actually that sense of risk and what else Garda Síochána might do as well. So at the local level, and as John has outlined, I expect in effect, the feelers to be out almost like a nervous system and to be receiving information and to be then responding to that. And I see that practically in terms then of the service delivery. I set out just earlier there the award that has been won recently in Drogheda around the policing response following the drug gang feud there. And that's an example of respond to local concerns around drug dealing, drugs intimidation, but just also generally antisocial behaviour, and helping then with other agencies to turn a situation around. And we have a lot of examples around that, working closely with other agencies, with other partners, in effect to make a real difference, to turn a situation around. So I don't think it's ever just about ourselves, but such is our connection on out into the community that I would be very confident about the feedback that we receive and how responsive we are to it. I think it is genuinely one of our strengths, Paul.
Could I just say, Paul, I wouldn't be aware of any community here that is so pervasive that drugs is kind of causing huge intimidation issues within the Portlaoise area, or like the big centre here. I think it's gone to a different kind of world now, that a lot of people exist using illicit drugs in benign environments, like they're not in the old. When I started out first, you were in very challenged, lower socioeconomic areas in Dublin. Now it pervades all stratas of society. So we have to be conscious that it's not just in lower socioeconomic areas that drugs are now a problem. They're in a problem across the entire spectrum. We also have responsibility here for the prisons, and we interdict, unfortunately, significant quantities of drugs being put into the prison environment as well. So that's another challenge for us as well. So, we could never be, as I use a mantra, and I said it to you yesterday, we must and can and always can do better, but we must always put that in front of ourselves as our challenge, that, every time we meet something. So when I came here 12 years ago, there was no drugs units. There's now drugs units at its most acute and raw stage. Thank you.
Thank you, Chair. So first of all, I'd just like to say that we very much welcome the decision of the Garda Síochána to approve the Limerick-based community access teams pilot, which will see the Garda Síochána work with health professionals, including mental health professionals, to provide a rapid, multifaceted diversion away from the criminal justice system for people who are presenting with a mental health crisis situation where that is appropriate to do so. And we also welcome the fact that the Garda Síochána has worked so closely with the HSE on this project, so that there is a very strong health component to the response. So I'm not sure if it's the Commissioner who's going to take questions on this. But would you agree, Commissioner, that it is an appropriate response for the Garda Síochána to treat people presenting with a mental health crisis, whether they're adults or children, in a way that diverts them away from the criminal justice system?
Well, I think in effect, this work started with Police and Service for the Future, and I don't want to speak too much because Jerry has done a huge amount of work on this, and I'll let Jerry in to talk about what's been achieved in the Limerick area. But it's very clear from other jurisdictions the strength of this response. It's a well-established response, again, in other jurisdictions. And I think what we've got to now is we have a viable pilot. We have this symposium, the report on the symposium, which in effect is, I think, it condenses experience from other jurisdictions, and then how we would take this forward. I think in the context just of two other reports as well, which is the National Standards for Adult Safeguarding and Sharing the Vision, a mental health policy for everyone. So we're not obviously alone in this, and individuals who obviously are presenting with a mental health issue, we sometimes are the first port of call for individuals who are reporting incidents, and invariably then we get involved in that. But by a long shot, we are probably not the best state agency to deal with this, and this is to try and then divert people away from, in effect, a policing response into far more a health-centred response. And so the work that's been undertaken around here, I think, on this is really valuable, and we want to be sure that we've got the foundations in place so that we can build on the Limerick experience and then lift this in effect into a national programme working in partnership with the HSE. So we're taking steps forward with this, and there's a lot of learning to be derived even from what we know so far, but we now have to make this live, run it and see then what happens. But we certainly can see that in very many cases in these instances criminal justice response is not appropriate, and indeed best that we can call upon health professionals who can more properly deal with the matter than us. But I have to say again, Jerry has led in this, taken great personal interest in it, and really driven it forward, and he'd be best placed to explain just the next stages of the pilot then.
Well, no, and it's great to hear that the plan is to roll it out on a national basis. So maybe you'd like to tell us, Jerry, a bit about the pilot and how it will run, and maybe how long it's envisaged that it would run for.
Yes, a lot of work has gone into this, and I have to thank our colleagues in the HSE who are the key partners in it. So any response in relation to dealing with people with mental health has to be health driven. And where the Commissioner has alluded there to the fact that we deal with thousands and thousands of people every year. You know, this year it'll be nearly 7,000 under the Section 12 detentions, not to mind all of the other interactions we have in relation to mental health and drug addiction and temporary psychosis and all those different issues. So any response has to be health driven, and any follow-up on it as well has to be community-based, and it has to be health-driven as well, and managed in such a way that we can get solutions. So the CASTR Community Access Support Teams started its work back in March 2021 with the steering committee, which was set up with the HSE in the Midwest after we approached them following the Commission of Future Policing report, which recommended that we would develop a multi-agency approach to dealing with people with mental health issues. And that has happened, and an awful lot of work has gone into it. So the report that came out of that has been extensive. A very extensive submission was made to the Commissioner, a joint proposal actually by myself and the Chief Health Officer and the Chief Officer, Maria Bridgman in the HSE in the Midwest, who also submitted it to their side of the House. So it's been accepted on both sides, in the HSE and on Garda Síochána, as a way to go forward with this cast. So at this stage, we're about to sign off on the initiation document in the next week or two, which really tells us exactly how the project will work, the timelines for it, how it will be evaluated, how it will be staffed, how it will be financed, and that's about to take place in the next couple of weeks. But it's obviously dependent on a lot of different issues, particularly in relation to the staffing of it. It will be project led by the HSE, and they will have staff with them in relation to that, and we will have our team on our side. It's been costed as well, and we weigh the funding of it. It's in the plans for the HSE for next year in the Midwest area. It's in our plans and it's in our policing plan nationally as well. So I think everybody's on board. Like the report that was issued yesterday from Andy Lacey, who's the superintendent, who's the lead on my team, who actually did the academic research with Dr. Alan Cusack in UL, reflects very, very closely the work done by the steering committee in making the recommendations on the proposal. And the 25 recommendations are very, very close to what's in the actual proposal. Maybe some of them will take a bit more time, but the idea of the pilot is, and I think this is important, that we don't rush into this solution. We have to have an evidence-based solution from the pilot, and we have to be informed about what that tells us over the 9 months when it comes in, but it will take some time. So the 9 months will start from when it's staffed, when the training takes place, international training takes place, and our own training and the HSE training, and it will start then. But we have to take it, I would say, rather than in a lot of projects rushing in, that we'll see how this works. And that was the International Symposium recommended that as well.
Yeah.
That, you know, a lot of different jurisdictions had rushed in and they wished to take their time. So I think it's an enormous opportunity to change the way we deal with people. And Garda Síochána are not the trained professionals to deal with people with mental health issues. You know, if we have trained professionals that would be fantastic. We have the CAD, it's a 3-phase, the CAD afterwards. So it's all very well to bring people in and deal with them, but what happens afterwards? And that's always been Garda Síochána's worry, and particularly members who are very committed to this, what happens the people that we deal with afterwards.
Okay. So just when this comes into being, what will be different for a person who, just to explain to people who mightn't be familiar, what would be different? So in terms of, say, a person who's arrested today here in this district and who might be arrested and have obvious mental health or other health difficulties, what would be different for them under the pilot to what they experience here today?
Yes, I suppose you're dealing with people with acute issues, and there are quite a lot, and we've done in-depth studies of those, analysis of the numbers, which would be about 340 people per division per year, which is nearly 7,000 people this year. But breaking them down, it'd be about 7 per division per week. So the experience for them, and hopefully there's a lot of benefits for this, particularly to the members involved as well, because at the moment a member arrives to deal with a person who is in acute stress or mental issue, or vulnerable, particularly vulnerable, who need help. And it takes, I suppose, between... Sorry?
Currently, would that person end up, for example, in a Garda cell, and would that be different under the pilot scheme?
It may, and it may for some of them, but not for all of them. So at the moment, the initial assessment piece takes between 10 minutes and 90 minutes to make that assessment. But if you have a professional with you, we may not get to that place whereby which we have to bring them to the Garda station at all. And the international experience is that person is able to step in. They may be able to provide a conduit to other services which may not require them to go to Garda station at all. So we would hope Section 12s would reduce, but the problem and the de facto situation is that after 5 o'clock in the evening until 7 o'clock in the morning and at the weekends, and Garda Síochána are the de facto people who look after people with mental health issues who present in a crisis. And that's the problem at the moment. But we deal with a lot more than the acute, a lot more. And when we did our study in Limerick in October, we came up with 240 calls in the month that could have been referred to our CAS team, and they would have dealt with those as well. And the international experience, I suppose I'd like to add this, is where police forces have brought this in, they swear by it. They say that this is the way to go.
Why? What effect does it have?
For the members themselves, obviously you have a professional with you. You're responding. They also have access to information from their systems that we don't have access to. They have professional training to deal with the person. Our members arrive, they secure the place or the situation or the person, having risk assessed it, make sure it's safe for them to go in. we bring in the person then, and there's a variety of calls. It may not be mental health, it could be a domestic violence type situation, it could be addiction problems, and an awful lot of people we deal with as well are what we call dual diagnosis people. In other words, drink, drugs has brought them to the point of maybe a temporary psychosis type situation, but the duty of care lies on us once we're involved with them to deal with them. They may be okay in 2 or 3 hours, and never see up to the psychiatric units or wherever they'd be referred to, or never committed involuntarily, so that's good. So there's only a percentage of that number that ends up there. So this would be better. You have a professional with you. As well as that, then the hub piece is very important, because whether they're brought in then under Section 12 involuntary or not, or whether they're dealt with and have access to the service down the road, that hub piece, and we went to Strabane to see how they did it up there, and that's managed actually by the community partnership manager. Looks after that, manages it independently, and they have access into a range of services.
So is a hub going to be outside of the Garda station? Is it going to be in a separate location or in a Garda station?
No, separate location.
Okay, and will it have a medical focus?
It is health, it's management. It's very much into sharing the vision policy that HSE have about community partnership, community care for the person right across a range of different areas.
So this comes back then to the issue of resourcing. So in terms of the pilot project, you've mentioned that there will be a nurse and then specially trained Gardaí, and we might come back to the training issue in a moment. But apart from having a nurse available on the pilot, do you have psychiatrist available, psychologists? Do you have addiction experts? Do you have are extra resources being put in place so that you can refer people to the correct agencies, and you're not going to have this situation where you're willing to refer the person, divert them to the correct health professional, but they're not available to you? Is the resourcing there to make this, give it a chance of success?
Well, the whole reason really for having the nurse there is that they are still attached with the HSE. They're not working for Garda Síochána. They have direct access into the services, so they can refer them in, they can make the appointments for them, they have access to the consultants, they have access to wherever they need to send them. That's on that piece. On the other piece then, for the hub where they're managed, all of the people that are involved with them at any level in the health service, but also it may be housing, it may be other issues which is managed separately. We only turn up really to the hub to say, yes, we interacted with them on such a date. This is what happened. We interacted. They're managed over a period of time. There are people who would come in contact very regularly with us, not just one officer or anything like that. These are people who are constantly in contact with us, and they're managed in separately. So we have very little access to that. We don't manage the information there. So that's all managed separately.
But are any extra resources going to be put in place for addiction services, for psychiatric services, for health services that are needed? Or is the nurse who's going to be part of this team going to refer to existing services which may have long waiting lists, for example?
That'll be a matter for the HSE to develop from their point of view. The initiation document outlines what we will be doing in CAST. And there are significant challenges to the HSE with regards to recruitment and providing services at the moment. So I don't intend to talk for the HSE, but
it has no chance of real success if the resources aren't there.
Yeah, the follow-up piece certainly will be very dependent upon that. But the CAST piece primarily is the call handling. It's the multi-agency approach. It's the initial approach to get them to the point where we refer them on. So after that will be the HSE. When do you think
this pilot is going to start?
This pilot?
Yeah.
We will sign the initiation document in the next couple of weeks, and after that a project manager will be appointed, and then the recruitment will have to take place, and that could be a significant challenge. So as soon as they're in place, we have people on our side and training as well. So possibly 6 months if we're lucky, it could start, and then it's a 9-month pilot.
9 months. And at the end, you mentioned evaluation. Will it be evaluated by on Garda Síochána in conjunction with the HSE and other professionals, or is it a Garda Síochána evaluation only?
No, it's most definitely with the HSE, and maybe primarily by the HSE with regards to the care piece. And certainly the effectiveness from our point of view with dealing with people from Garda Síochána. But we also have UL involved with us, and the team there have provided academic support in relation to all of it, and will help us and have committed to helping us in the evaluation when we come to it.
Thanks. Also, you just mentioned the prevalence of mental health calls outside maybe the Section 12 of the Mental Health Act acute situations. So do on Garda Síochána, and this may be a question more for the Commissioner, but do the Garda Síochána have a way of collecting data which demonstrates the draw on resources that mental health issues poses? Is that data collected?
We have the data analysts will be able, for instance, I mentioned earlier the month we looked at, and so we were able to extrapolate the information. That was actually done with the HSE, so we compared the figures we had with what they had, so that we knew. We could then see where we all off the one hymn sheet, I suppose, just to see was the information correct. But we've been able to access it through the Garda analysis service.
Okay. And in relation to current Section 12 detentions, there is a proposal that the Garda Síochána would be taken out of that process, and that only authorised officers who are appointed by the HSE would be permitted to make applications under the Mental Health Act under Section 12. You mentioned there that, Garda Síochána provides a 24/7 service, and that therefore they fill that void when other agencies are not working at 24/7. Do you foresee that there's going to be any difficulties when that amendment is enacted and it takes away that provision from on Garda Síochána?
Yes, we spoke to the Mental Health Commission in part of our work, and we made submissions to them as well. And it's going to be reliant on whether there's enough authorised officers, whether they're on rotation. During the day, certainly there's a big difference when authorised officers are there. But if they have enough of them, and it can work like that, but they have to be taken to a place of safety as well, and that's the issue. Whereas the de facto, when that authorised officer isn't around, that place of safety ends up being in the Garda station. So we would much prefer, and I would really like if there was lots of authorised officers and it was somewhere else, if they never came near a Garda station, or if we didn't have to come near a Garda station, as happens with the PSNI and in other jurisdictions, where they never go near a Garda station with somebody who's arrested for Section 12.
So in other words, are you saying that for people who find themselves detained currently under Section 12 of the Mental Health Act, that the Garda station is not the place that they should be, because this is a health situation and they shouldn't be in a criminal justice situation?
They shouldn't really. No.
And presumably
I would say that's the accepted standard internationally as well. Law enforcement internationally is removing itself from, in effect, what is a health crisis.
Yeah. So I'm sure it adds to the distress of the individual, and this potentially adds stigma to their situation. I'm wondering though, currently you still have to operate that system. What are effectively patients who are brought into a Garda station, are they treated differently to other detainees?
I would say there's a higher level of care. Certainly the custody regulations and the protection of them. GP is called immediately as soon as they arrive, because they have to do the assessment. We just hold them for the GP. The GP comes, who then authorises whether they're to be brought up to the psychiatric services, whereby they will be then assessed. That's all that they actually authorise. And the GP may, in a lot of cases, and does, because, as I said, the temporary ones also are there, and by the time the GP is dealing with them, they may well have improved, or they may be well able to say this is drugs, it's alcohol, it's whatever. They don't need to be brought up. And actually, between 10 and 18% is all that end up in psychiatric units.
Are those people, are your members trained to try and vindicate the human rights of that person? Do they have special training to do that?
They have the assist. Everybody gets the assist course in Templemore. We have the safe talks. We have the human rights custody regulations. The human rights course is ongoing. There's 3,000-4,000 people trained in that at the moment. But and also they're asked to look at the vulnerability pieces in relation to people that we're interacting with, which is recorded on Pulse as well. But the custody regulations and the member in charge has a vital role in it, in making sure they're okay. But again, we would prefer if they weren't in our Garda station, because it takes a substantial amount of time to deal with people who are brought in for mental health issues, and particularly if they're brought for assessment later in the hospitals.
There have been in this particular division in the Laois Offaly Kildare division, I mean, there's been at least one recorded incident of spit hood being used in a mental health presentation. What would your view of that be?
Yes, and I suppose, you know, some of the people we arrest or detain under the Mental Health Act are violent. Some of them can cause a threat to either us or the public, and sometimes you have to use reasonable force in order to get their compliance. So, you know, in a perfect world, no, you wouldn't use it, but sometimes the situation gets whereby they're completely, you know, upset and mentally unstable, and that it's very, very difficult to deal with them. You may have to hold them down or whatever, and that's the reality of dealing with people, you know, on a day-to-day basis in a custody area. You may sometimes have to use it.
Do the guards ever assist in restraining a person beyond the guard station in a hospital situation, in your experience?
Sometimes, in my experience, which is extensive at this stage, many hospitals have security, but not very much security, and we would often be called to help out with the security aspects in a hospital where something would kick off, where people would need to be held down or whatever, but it would be in relation to a specific purpose. So whatever that purpose would be, usually to try and restrain the person, but generally that wouldn't be common now. It wouldn't be common.
Does the Garda Síochána have an overall strategy for dealing with mental health issues, and do you think that such a strategy would be helpful?
I think we're developing the strategy. I think all of the Commission of Future Policing has made it clear that we need to develop a strategy as well. It's in our policing plan, and we have many laws that we have to comply with, particularly the Mental Health Act and the new Mental Health Act. So all of the procedures that are put in place to deal with those. So yeah, I think we're in developing, and we're at a crucial stage with regards to that development of that strategy.
And I think the report that you've referred to, the recent report by Dr. Cusick and Superintendent Lacey, does refer to the fact that a lot of Gardaí feel under-trained in identifying mental health issues, neurodivergent issues and intellectual disability issues. And do you think a strategy to bring in better international standard training would assist members in that difficult duty?
Yes, particularly the ones that are going to be involved in the team. They need to be at a higher standard. And we've not included these will be specialists, but we would have about 20% of the division will be trained up in Limerick. So that provides a big spread of members right throughout every unit who will be able to take up that duty when required. So that's that aspect of it. But there has to be a general training as well, and we are recommending that there will be a general training in relation to mental health. All our members get trained anyway, in regards to assist and safe talk. But you know, it's how far can we go with this? We're not mental health professionals. This is the proposal. The proposal is that we get mental health professionals with us. We're guards. We enforce the law. We arrest people, we detain them, we do our best for them with regards to their duty, our duty of care to them. And I don't know how far we can go with that training beyond that.
Okay. I think I've run out of time, but best of luck with your pilot project.
Thank you very much.
Thank you for that. Excuse me. I attended the symposium at the University of Limerick, I think it was in April, when this and it was when this project was being discussed, and it was impressive and encouraging. to see and to hear representatives from police services in Northern Ireland and in Scotland and Canada and the United States who were reporting on their engagement and what has now become a constant and regular part, gone beyond the pilot stage. And the development of this CAST pilot is a really, as we've just been hearing, a really positive development. And we look forward very much to you being able to progress it as quickly as you wish, but also to hearing more about it as it progresses, and particularly when the review of the pilot process will have been ended. And if I can ask Chief Superintendent Roach, will you retain your engagement with this, even though you've moved to a new divisional responsibility?
Yes, I'm the project owner for the organisation, so I also sit on the high-level task force in relation to criminal justice and mental health. I have a national profile on it, but we will be given local implementation to the local chief in Limerick.
Very good. Well, every good fortune with that, and every good luck in your new divisional responsibilities in Galway as well. And thank you, Jerry.
Thank you very much.
The next two sections under this theme of policing service and response, and I should have said thank you to Shalom as well for the engagement on that part of it, relate to services to victims 5 years on from the Victim of Crime Act, and also victims' attitudes arising from the Public Attitudes Survey. These two will merge one into the other, and to begin this as a scene setter, if you like, the Chief Information Officer, Andrew Sullivan, is going to make a brief presentation to us on the Public Attitude Survey.
Thanks, Chair. And broadly in line. Oh, thank you. Moving on then to another driver, obviously, of satisfaction is trust in Garda Síochána as a policing service, and again that stayed at more or less the same level. Again, a slight increase in the number of people that are very satisfied, but overall trust levels very high and very consistent with the satisfaction level overall. So we believe that there's a strong correlation between the two of those, obviously. So moving on then again into satisfaction following contact. Again, that maintains quite high consistency with that overall satisfaction rating. This isn't the satisfaction rating of people that have engaged with us. This is the satisfaction with that engagement. So with that level of contact. So again, that's quite high. It's quite interesting, and this is something I'm just going to come back to in a few minutes as we explore victim satisfaction. Is the degree of the higher degree of face-to-face contact and the more personal the nature of the contact, the higher the level of satisfaction tends to be with the contact and the service provided overall. So just one example of that on the right-hand side there is where the contact was on the basis, or the initial contact at least, was on the basis of a visit to a Garda station. That's higher than where it was on the basis of contact by phone. It's not significantly, but again, that would be in line with customer service practice generally in all industries. The higher the level of personal contact, the higher the level of satisfaction. So again, moving on just a little bit more then on the drivers, I suppose, behind those quite high levels of trust and high levels of satisfaction. Again, quite consistent when we dig down into that into a little bit more detail. High levels of human rights focus, which was a new question this year, seem to be friendly as helpful as the highest end, a bit lower than on the organisation in terms of being well managed and effectiveness in tackling crime. But again, around the kind of the 70 to 80% mark mostly, which is again consistent with overall perceptions. So one other question, I know it wasn't directly the point that you wanted to raise, but I'm sure there'll be quite a bit of interest in this. A new question that we'd raised was relating to awareness or satisfaction, I suppose, with diversity on Garda Síochána. And we can see there that that's significantly lower than some of the other satisfaction ratings at 54% overall. And in particular, in more diverse areas, Dublin in particular, you can see that perception is lower again. One of the interesting things about this is that, by and large, most of our questions have a very low, we always include a don't know component, even on satisfaction questions where there's a range. They're very low, which is the reason that we don't generally include them in the surveys. But on this one, the don't know is quite high, and understandably, because it's a yes or no question, and people may not feel qualified to, to answer that. The other aspect of that, I guess, though, is that diversity encompasses many different demographic and personal characteristics. So maybe the more obvious question is people are basing that perhaps on things like ethnicity are the ones that are more obvious, but obviously there are other forms of diversity as well that perhaps the public doesn't feel as well informed on. So, following on, I suppose, from the work of the survey, and also just our awareness of the need to measure diversity as a public service organisation and across the public service overall, the Commissioner is leading on this from a public service perspective, and we're going to be the first public service agency that's going to measure diversity across our entire organisation. So we have a pilot project underway with the CSO. We've jointly developed the methodology, and we hope that will come to conclusion by early 2023, and that hopefully will then start to answer the question for people that aren't aware of what the diversity is and that level of kind of don't know, to be able to put an objective measure together with the CSO on what exactly the diversity is in Garda Síochána, again across multiple variables, not just the more obvious ones perhaps of ethnicity. So moving on then to victims of crime. So about 15% of the respondents had contact with Garda Síochána. That doesn't necessarily mean they were a victim. In some cases, that contact was initiated by the guards, but mostly they were victims. 75%, as I said earlier, were satisfied with this initial interaction. It's important to note in this is that the way that we carry out the survey, we do not engage or survey basically people that have been the victims of traumatic crime or victims of sexual abuse, and that's in keeping with good practice in terms of surveys, because the surveyors, the interviewers are not qualified, and there's always a risk of re-traumatization there. So all of these victims would be what's loosely termed as kind of volume crime, which in turn is mainly property related crimes such as criminal damage or burglaries at home. So just if you hold that thought on that kind of 15%, I'll just break that down a little bit more. So satisfaction among victims is slightly lower than it has been in previous years, and we're going to get into that in a little bit more detail, or get behind that in a little bit more detail in a minute. So previously it was around the 60% mark, maybe slightly higher. It's now 59% in terms of satisfaction of how the satisfaction of how the case was handled overall. That's slightly different, I suppose, to the satisfaction with the initial contact. And again, that's something that we've been analysing in terms of how the satisfaction might change overall as a case progresses. So again, slight change there between 2017, 2019, but broadly kind of similar around the 60% mark. So then when it comes to reporting crimes, again, it's quite high. Bear in mind, we know that the reporting rate for things like domestic abuse are still underreported, even though they have been improving significantly. Again, bear in mind, this does not include domestic abuse cases. This is primarily about volume crime, and we can see there again quite high reporting rates, slightly lower than it has been in 2017, 2018, slightly higher than it was in 2019. But again, when you're up around the 80% mark, it's there's probably not going to be a massive amount of change. A little bit more interesting, and I suppose opportunities for us, certainly from an improvement perspective, is the more detail then behind that as to the nature of the interaction. I think I've got that in a little bit bigger on the next slide. So broadly the same in terms of Gardaí responding quickly, and again that points to that very good initial reaction. It's actually slightly higher than it was in 2019, but then when we look at the name of the investigating Garda, that's about the same. It's kind of slightly lower, but more worrying certainly is the drop in people thinking that they were or feeling that they were given the pulse identifier or the pulse reference for their case, and then also being given details of victim helplines. So there's something behind that. Obviously, it dropped a little bit in 2019, but it's taken a significant drop there in 2021. So I'm going to come on a little bit and just talk about, I suppose, perhaps some of the kind of the drivers behind that. So again, when we look at another question which dealt with if there had been a follow-up from Garda Síochána after that initial report, again, that's quite high at 66%. bear in mind our target for 7-day callbacks for victims of domestic abuse, which is extremely tightly monitored, is around that same figure. So very strong compliance there, I think, in terms of following up with victims, which
Sorry,
isn't.
Andrea,
Yeah.
I think you might need to move on to the next slide.
Sorry about that. Oh, thanks for that. Yeah, I'm looking at 2 different slides here. Sorry about that. So follow up. Sorry, thanks for that. Yeah. So so as I was saying, there are 66% of people feeling recognizing that they had a follow-up contact following the initial contact, which generally seems to be positive. So that's quite a good kind of follow-up rate after the initial contact. But again, then more worryingly, when we look at this in the round, is the number of people that felt that the level of information, which was probably across the entire investigation, only 51% felt that was about right, 28% felt it was too little, and particularly concerning is the fact that 19% felt that they didn't get any updates on the progress of their cases. So just to start to get behind that a little bit more, no, sorry, I'll stay on that last slide. There's a number of actions that we've taken. AC Cleary may come in just to talk about overall the kind of the actions that we've taken since the introduction of the Victims Act in 2017. But I guess the key point is that a lot of the actions that we took then, just as, for example, the system of letters, there's in total 4 letters that could go to a victim over the course of the investigation. They are physical letters, and certainly in this age of digitalisation, our goal would have to be that we would develop a victim portal over time. So what we've decided to do, and again, partly driven by these figures as they've emerged over the last few months, is that we're immediately going to put in place a system of email contact, because even though the letter is sent, in this day and age, letters may not be kind of received. We think that's certainly some of it, having spoken, and we have consulted with the victim offices, that letters either go to a temporary address and somebody's already moved on. It could be sent to a student and they're back with, or it's gone to their parents' house and they're somewhere else, as one example. So following up with email, we figure will be a better way of doing it. And even though we do provide the email address for the victim services offices and welcome contact from victims of crime to follow up with the victim services office, again, they may not spot that in the context of what's really a sort of a pro forma letter. So again, just on the general principle of good customer service, trying to make this more personal, the introduction of email should help a little bit better in terms of people being able to follow up. And we can also, I suppose, if we have the right email address from the initial contact, at least we can demonstrate as well then that apart from what we do monitor very closely now, that the letter was sent, that we can prove at least that the email was received. We're also introducing a new Garda mobility app. It'll be in 2023, just to help Gardaí in their contacts with initial victims. Obviously, they record on Pulse and will be recording on the new CAD system details of the crime incident, but they will now have a new app as well, which allows them to record information on the victim, such as their preferred contact mechanisms. So that's, I suppose, the kind of the main focus that we have is improving the channels of communication and augmenting the channels that we have previously. I would say though that we do monitor very closely, and including at the Deputy Commissioner's monthly PAF meeting, the number of leaflets, the fact that leaflets are distributed, and so this is something of I suppose of concern to us, and we've got a series of actions there to continue to improve it. So thank you.
Thank you, Andrew, and over to Paul, who's going to lead on the next. Thank you.
Yeah, thanks very much. Andrea, I might come back to some of those stats shortly, but maybe just first of all to ask, I'm not sure if it'll be Assistant Commissioner Cleary or the Commissioner. It's 5 years now since the Victims Act was passed, and obviously that should have marked a step change in the way not just the Gardaí but lots of other organisations were liaising with and vindicating the rights of victims. I wonder, could you just describe how you think the nature of the service that you have provided to victims has changed in the last 5 years?
I'll first turn to Anne-Marie, who can give a before and after answer perhaps better than myself. In that, on my arrival, a lot of the victims' offices were open, and I felt providing a very good service. But if Anne-Marie can set out the work that's been done already, and then Paul is undertaking other work at this moment in time to further refine our approach. Thanks, Anna.
Thank you, Commissioner. So once the EU directive was in being, we set about, I suppose, reorganising our structures and services to meet the needs of the as set out in the directive. So by the time the Act was enacted, we were in a good place. So one of the first things we did was establish the 28 victim service offices right around the country. They were staffed by and are staffed currently by a Garda member and a Garda staff member. So those offices provided a central point of contact for victims right around the country. Side by side with that, then we developed a number of letters. There were letters there prior to that, but we increased the number to try and meet the needs of the directive in the context of providing updates, providing follow through, and so forth. Now, that's almost 7 years ago since those letters were developed, so time has moved on. So, you know, as we can see from the survey results, there are some challenges there in terms of how those letters actually land with victims of crime, and probably we need to move on with the time. So whether that's the email or some other, or the portal as Andrew has mentioned, or indeed text messages or other means. So there's probably multiple options we need to provide to victims, as opposed to just sending the letters and hoping that they meet the needs. So that's very much a work in progress, and we have a small group looking at that currently. Side by side with that, then, there's also provision in the directive and the subsequent legislation in terms of providing reasons for non-prosecution. They're provided on request in the same way as they are provided with the Director of Public Prosecutions. And we also then are closely monitoring, and this really came about as a result of our obligations in the directive and subsequent legislation, our callbacks to victims of crime, our issuing of letters. So we closely monitor that through a series of KPIs on a monthly basis. And in addition to that, then, I suppose our overall focus on victims is growing and evolving all the time. And if we only look at the protective services bureaus that are established right around the country now, that's another part of our service to victims of crime of a particular category. Operation Fuishiv, that was implemented during the COVID pandemic and had several iterations, it too speaks to our obligations in terms of victims of crime. So I suppose I think that we're in a much better place than we were 7 years ago. I think that space is continually changing and evolving, and we have to do likewise. So Paul now is moving this on to the next stage and looking at what has gone well, what do we need to do into the future. So I'll just hand over to Paul just to speak briefly in relation to that. Thank you.
Thank you.
Thanks, Deputy. So I think the Deputy has covered a lot of what we have done. The 2017 Victims Act placed certain statutory obligations upon Garda Síochána when it comes to victims on their journey within the criminal justice system, and a lot of it is weighted heavily towards first contact. And you know, so we have developed a process there whereby when you take a report of a crime from a victim, that they will receive a victim's information card, which will have the guard's information and also the support services for information that they may require on their crime or on the progress of their investigation. But if I can just break it up into our response into 3 different areas, starting at the top with the most serious of crimes, murders, abductions or fatal road traffic collisions. In each of those type cases, you will have a trained family liaison assigned that will give that one-to-one engagement with the victim's family and provide them with the supports and information they need. If we take it down then to victims of domestic and sexual gender-based violence, they will get a more enhanced engagement from a victim point of view, insofar as you have your risk evaluation tools done upon the receipt of the report. You have your dedicated callbacks, and those victims won't receive any letters from the victim support offices. That will be one-on-one in an agreed format. And then when you come down then into the volume crime, as I said, at the first point of contact, they will be provided with the victim card. That will direct them to the victim's information booklet, which will give them extensive support information and that's on garda.ie. This booklet's available, and if they're not on the internet, we can give them a hard copy or post it to them. In addition to that, then, we have performance assurance piece built into Pulse, whereby you will have a victim assessment screen when you put the incident in, and then you will also have a victim engagement tab to monitor the progress. And that's to allow the sergeant and the superintendent in the PAF system, the performance assurance system, to make sure that we are given a tailored response to the victims within that specific crime type that was reported, because there's different responses, even for the same crimes, for different people, depending on the circumstances. So on that first tab of the victim assessment, Pulse will show up if this person has been re-victimised, if they've been a victim previously. So that in itself will ensure a tailored response from the sergeant and the superintendent. So moving on then from the first contact, as I said, the tailored responses, there's a different one then around tourists. We will always bring tourists to the Tourist Support Association and make sure that they get their Pulse record crime number as soon as possible, and provide them with tailored supports as well. In relation to the...
I wonder, might I just, sort of conscious of time, Assistant Commissioner, it seems, and certainly the feedback that we would get, I think, from engagement that authority staff and members would do in some of the visits that we would do to areas like this, would suggest that there is quite a lot of good practice around DPSUs, etc., and some of the changes that have been made in relation to those. I suppose there is a concern sometimes raised with us around inconsistency in approach, and that's featured both in some of the engagements that we've had in this division and previously when we were in Monaghan earlier in the year as well. And when you look at the stats that Andrew just presented around volume crime and the service that's been given to victims in relation to volume crime, that suggests that there is a bit of an issue. I mean, I know Andrew touched upon it and acknowledged that, but, you know, on my reading in terms of the provision of information, it's about half of victims that say that either they get too little or none at all. And I'm just wondering, I mean, obviously the survey seems to have picked this up, but is that a pattern that you would have recognised yourselves?
Can I come in there, Paul? Yes, absolutely. And I suppose we've been monitoring this certainly since this information came to our knowledge in the early stages of the public attitudes survey. We've a group put together to look at this and try and get to understand, because there is a lot of information provided, but whether it's what victims want is the question. And, you know, our 4 letters are obviously not hitting the mark in terms of what's required. So we're actively looking at that, and it's something we have identified and we're acutely aware of. And really, we just need to pivot into a place where we're providing what actually victims want in a mode that they want it. So it's very much a work in progress, and it's very much on our agenda.
Okay, and just one of the other figures that I think I picked up was that 31% of victims reported no contact at all after they had reported the crime. And that again seems quite a stark figure. And so I understand and I appreciate that you've received these figures now and you're looking at them yourselves and you're trying to address them. But I suppose my question would be, you know, did you have to wait for the public attitude survey to reveal this pattern, or was this not something that you would have picked up yourselves?
If I could perhaps take that. So I suppose just to be clear on what the figures are telling us, the figures relate to satisfaction with the level of information on progress with the investigation. So the indications are, if you look there at the number of people that said, victims that said that they received a call after the initial point of contact, that was 66%, and overall 75% of people were victims, again, were happy with the initial contact and the responsiveness. So what this is showing, I think, is something is going wrong with the level of information provided, as the investigation progresses, but it's not with the initial response. And I think that figure there, with no information at all, again, was on the progress of the investigation rather than on the kind of the initial contact. But that said, exactly as the deputy said, we have been aware for some time. It's actually in a number of our strategies, the fact that we need to put together, in a digital age, we need to be moving away. We should have moved away by now from a letter-based system to a much more interactive system. And again, going back to that nature of personal contact being the main driver behind good customer service and good customer satisfaction ratings. So we're not in a position to progress that, but the email channels and perhaps a text channel certainly, I think, is going to improve that. The other thing that we're doing, and this, exactly to your point, I think, Paul, is to understand more about what's behind this. So yes, we did know that it was an issue, or it was likely to become an issue, and in fact now digitalisation as one factor certainly has caught up with us. But the other factor that we need to look at very carefully is to understand, again, this is telling us there's an issue, and we need to find out what that issue is. So what we're planning on doing is to do a more detailed survey, trying to focus particularly on victims, to get behind these figures, to figure out what is it? Is it, as we don't think it is perhaps, but is it with the initial contact? Is it with the channel of communication? That's certainly something that we think is an issue. Is it with the fact that that we're perhaps then not answering questions as they come in? But one thing to note about that, we do track the number of emails and contacts that we get from victims after the initial letters are sent in, and it's actually quite low. So a relatively small number of victims contact us. I'm not saying that's their fault or anything like that. Perhaps we're not being proactive enough about telling them how to contact us. So we've got a number of things to work on, I suppose, from this and from other sources of information, and that'll allow us to put a plan together. But the most immediate thing I think we can do is to implement some degree of digitalisation in conjunction with the letters, to at least send out an email which can be responded to, and that'll put them immediately in contact then with the Victim Services offices, and then onwards with the guards that are looking at their cases.
Okay, thank you. Because one of the other things I think that survey seems to show, Andre, is that satisfaction levels, which you rightly say are very high across the board, but those who've had contact in terms of being victims of a crime, satisfaction levels are lower. And I'm just wondering what that tells you about the engagement with the victims, because it suggests it hasn't been a uniformly good experience.
Well, there's a difference obviously between, I suppose, the general public's perception of Garda Síochána, because it's an overall perception as opposed to somebody who's been a victim of a crime, and I suppose that's the kind of the key point. It's that they've been a victim of a crime, so there's an issue with that, obviously, kind of straight away. But I mean, clearly there's work for us to do there, and it should be a relatively easy thing for us to fix, compared to the investigation of the crime itself. Is that if information and if contact and the nature of the contact is the issue, and it is an issue we're seeing from this, that's something that we can deal with. So I mean, absolutely, we accept what this is saying, and we need to get behind it and to address it, and I'm confident we can.
Thank you. And maybe just one final issue. I mean, obviously one of the obligations under the Act is to, and generally speaking, of course, in the way the guards will interact with the public, is to treat everyone fairly, irrespective of their background. Obviously, across the country, it's a much more diverse society than it was. We heard yesterday from the Chief Superintendent in relation to this division as well, much more diverse than it might have been in the past. Are you confident that you are reacting to and providing a response to victims in a consistent way and a fair way in terms of the background of individual victims?
Yes, that's a key focus for us, and I suppose, different victims have different experiences. They're coming from different perspectives, but regardless of what the crime type is, or what section of the community that an individual victim may be from, our approach and our mission is to provide a consistent, reassuring and reliable service to all victims.
Okay, and I wonder, can you just, I don't know, do I have time? Yeah. Can you maybe just say a little bit about how you're assured at a senior level that is the case?
Well, first of all, we have all our policies and procedures in place. So all our documents are, I suppose, general in their nature. Then we have some, specific policies in relation to victims, and the application of those, I suppose the fruits of that are in the survey. And yes, there is some work for us to do in the context of some of the ratings, but generally speaking, the satisfaction levels across a range of areas is very positive. But we're constantly alert, and our antenna is always up in terms of areas where we might need to do more. And I suppose through our community policing teams and various other strategies, particularly under the community engagement area, speak to that. And we have various outreach. We work with NGOs. We constantly there's a feedback loop there in a consistent way. So can we be ever totally assured that we're doing everything 100% consistently across the entire country? Probably not. But that's our aim and that's our mission.
Just one thing to add to that, Paul, is that we do have I didn't have it in there, but there is a question in there on fairness in terms of, do people believe that they would be treated fairly by Garda Síochána? Again, that's quite high. I don't have the exact figure, but it's well up in the 80s as well. The other question then on that we're not publishing this time around, we did measure in 2021, is that the increase in the survey size has allowed us to measure this on a divisional basis. So from the 2022 survey results, which we certainly hope will be published a lot earlier than the 21 results, we'll be publishing, or we will have the divisional breakdown, which will allow us to indicate if there are pockets, kind of nationally where this is an issue. And the last thing I'd say then is just on the kind of the diversity one, that's again a kind of a measure for us, or an indication that that's something that we need to work on, particularly in some areas where the perception of diversity, and rightly so, I'm sure, is lower in some areas compared to others, and that's another lead indicator for us, I guess, to work on.
And even in terms of the disaggregation across divisions that's coming, that you talked about there, I mean, that might help in relation to that, because there will be some divisions that you'll know yourselves are much more diverse than others.
Yeah, and it'll be an interesting, I suppose, correlation there between the diversity gap and perception of a diversity gap obviously is much bigger. If the community is more diverse but the Garda organisation isn't, then that gap is going to be bigger, and then that in turn may lead to a change in a perception of fairness and others. So I think that will give us. But I think the other key thing is to be able to actually publish, which we will hopefully early next year, to be able to publish our own diversity figures. So that at least be an objective measure as opposed to a perception, and that may lead to even more informed feedback next year when we say this is what our diversity is, and then people can comment on their satisfaction with that as opposed to their perception of what the diversity is.
Okay, thanks very much. Thank you.
Just you talk there, Deputy Commissioner, about these letters, and that's an area for improvement in the context of people saying they're not getting, sometimes not getting a response. The 31% of the respondents, they're saying that they didn't get an adequate response. What we keep hearing when we talk to community groups around the country are that, particularly in relation to domestic violence, that people are being told if there's no domestic violence order in place, that the Gardaí can do nothing for them, that they are not familiar enough with domestic violence orders, and sometimes are being incorrectly told that the Gardaí can do nothing for them even where an order is in place. So we keep hearing the same things. We hear that people have made complaints, maybe have evidence available, and Gardaí are not coming and collecting that evidence and are not following up. We never hear that there's an issue with letters or the 4 letters. But what people want when they contact the Garda Síochána is they want to know that whatever crime they've reported is going to be investigated. And that is repeatedly, we hear, particularly in the area of domestic violence, that there are very serious shortcomings in that area. Have you anything to say in response to that?
So just to be clear from the outset, victims of domestic violence don't get letters. We purposely, they're a category of people that where there is personal intervention, and for obvious reasons we don't send letters because they may aggravate the situation. So so that's the first thing to say. Secondly, then I would say that over the last 2 years or so, we've done extensive work around, the training our members in terms of orders and the various orders. So I would expect that our members are able to advise victims of domestic abuse in relation to the various orders and how they might go about them. So I would expect that. Secondly, I would expect if there's a crime committed, i.e. if there is a breach of an order, I would expect action to be taken. And then if there aren't orders, but there are other offences disclosed, well, then action can be taken in relation to those. So there are few enough occasions where we couldn't take some action. And I'm not saying the situation is perfect, but certainly there is a huge focus in terms of domestic abuse and our response to it. And I suppose Operation Fuishiv, as I've referenced earlier on, is a part of that. And then we more recently have the rollout of the domestic violence risk assessment tool, which is now in all the regions and all the divisions in the country. So I suppose we're constantly upskilling our people. If there are any parts of the country or any particular incidents that have come to your attention, I would ask that we would be made aware of that as quickly as possible, so that we can maybe take action and maybe focus renewed training or whatever is required in that regard. But certainly, organisationally, it's our obligation under Section 7 of the Garda Síochána Act to investigate all crime and all incidents of the nature you describe.
Sorry, Chair, if I could. We explored this yesterday, this concept of shortfalls perhaps around that area. And I think we dealt extensively with you from the superintendents who manage the PAF screens each morning, and they go in and they look at the incidents that are generated coming through from our CAD system, coming through. And to underpin that again, in case there was difficulties around that response, you heard from Superintendent yesterday talking about examining the risk assessments and ensuring that there isn't an individual within the system even downgrading what should have had a better response. You also would have heard that that all our attention and complaints incidents, which should have a higher, are examined on a daily basis to ensure that not hidden within that sphere of our recording system, there would be something which should have been categorised as domestic violence. And I'd be very concerned if in your interactions here in this division you had heard from any significant cohort of the population suggesting that domestic violence orders weren't acted upon. There's some very serious mandatory policies around that for us. I suppose the pandemic really sharpened our focus on domestic violence and how we approached it. And you heard words like, I am passionately believing in the response to this from a particular superintendent yesterday. And also from at least two of my superintendents yesterday talking extensively to this area. This is the one place that we all believe we must give of the most excellent service, whether and we've told you of examples of extra initiatives we put in place to protect potential victims who are not fully engaged with us. So, more than the Deputy Commissioner, I'd be very anxious to hear from any incident in this division where there is a shortcoming in a response to a domestic violence incident. Thank you.
Thank you for that. We heard what the colleagues said yesterday and the superintendent said, and there's no suggestion that there is any doubting the sincerity of what was said. The reflection, however, and we will have further contact with the Commissioner and the colleagues, it's a reflection of a persistent is the wrong word, but a regular feature of the response is that in certain circumstances an inadequate understanding of the law in relation to domestic violence is revealed, and that in certain circumstances there can be an inconsistency in the quality of the response. And while, as has been, everybody agrees, nothing will ever be 100% consistent in that everybody will never respond in exactly the same way. It is very useful to reflect on the views and comments that we hear from communities, from individuals and from those who are working with people who are victims, which may be of benefit, and we will, as I say, pursue some of these contacts with the Commissioner and the colleagues. And thank you for those responses on these important areas. We had intended on the agenda to have the issue of the sign-off, as it were, on the DNA samples question and the assurance that all of the recommendations of the report of September 2020 are being implemented. That document arrived last night and we didn't have an opportunity to consider it, and we will consider it at the meeting of the authority in the middle of December, and we hope bring it to its conclusion at the meeting in public in February, Commissioner, so we will come back to that. And the final item then is crime trends and resource planning, and Donald de Butler is going to lead on that one.
Thank you, Chairman. If I look at the numbers, based on last year, crime is up. You'd expect that because of COVID. Just one initial question is, sometimes when something outrageous happens, the fear of crime, particularly among older people, perhaps may get elevated. Could I get your assessment of the level of crime in this jurisdiction compared to comparable other jurisdictions? Is this a relatively low crime jurisdiction? Are people right to be fearful? What's
I think there is a perception around the fear of crime, and I think some of that perception is driven by the amount that crime actually features in the news, be it the actual incidents and then subsequent then trials, etc. And perhaps that's a feature you don't see so prevalent in close neighbours or indeed across in European neighbours, but it is prevalent in other countries as well. And we do have a bit of a fascination, as a national fascination, on crime and criminals and trials and outcomes, etc. But I would say this is a safe society, and we're working hard to make it safer. There are obviously been recent incidents reported to us, particularly around antisocial behaviour in our city centres, and we've responded with vigour to those, and particularly in Dublin, for instance. So I have to say, as an organisation, we are responsive whenever we see that there is an issue. We respond to it, and all the time we're becoming more knowledgeable about where the threats lie. And I think the work that Andrew has led on, in particular, around the relationship that may exist between victim and offender, often an intimate or familial relationship, that gives a lot more guidance actually to the real threats and risks within society. We do have a focus on those who are vulnerable. That's been part of FUISIV, and that's really informed us around where vulnerability lies, and actually repeat vulnerability for individuals as well. But then that takes us on then to the next stage, which is identifying those individuals who are repeat offenders and create a threat and risk themselves. So that's all work that we're developing, and in effect, a lot of our analyst work is really at the leading edge, particularly that victim offender piece, and being able to describe that in real detail, and far greater detail than we could even 2 years ago. But beyond that, then I do think that there's a bit of perception which is not actually the international reality of where we are. Okay. Like by and large, this is a society that looks out for each other and actually assists each other, and that's clear to me, even in terms of our investigative effort, the amount of information and indeed witness evidence, etc., we get from the public as well. The public are active in terms of being good citizens, and policing in some extension is by extension is a form of good citizenship as well. And I think we're in a pretty positive. I think we're in a positive place there, and certainly amongst our peer nations of developed democracies, I think we're in a good place.
Okay, thank you.
Sorry, just comment on the
yes.
on the overall trends.
Yeah.
Because you're absolutely right, of course, that individual high-profile incidents are cause for concern. But just to support what the Commissioner said there, and it is in the Commissioner's monthly report, that the trend for most types of crime is generally downwards. So the trend for burglary certainly is quite significantly down, and that seems to be repeated again this year. So for the first time on record, actually, the number of burglary incidents fell from September to October, which never happens really, because usually they go up as the nights get darker. I'm not saying that's going to be repeated. It may go up again in November, but generally the long-term trend on burglary, on property crimes is down. The number of assaults generally is about the same, and homicides has dropped off significantly. But the nature of crime does change over time, and so 5 years ago the dominant factor would have been in homicides would have been organised crime related homicides, but now what we see as the numbers have dropped down, the dominant factor now is domestic abuse. So that means that there's a change, as we've talked about before, in the way that we respond to it. But I mean, obviously individual crimes are always going to capture the imagination, but as the Commissioner said, generally it's a very safe society. But we are seeing a change in the nature of crime. We saw a big increase in economic crime, fraud during the pandemic. Again, that's come down again, possibly with the end of the pandemic, but certainly as a result of the Economic Crime Bureau as well. But certainly the figures compared to other countries are lower, and also that they continue to go down. But there's no place for complacency, obviously, with things like domestic abuse, is that that's still an area that's underreported, even though reporting has gone up, and that obviously needs to be a continued focus as one example.
To come to the issue of resource allocation, one of the great challenges of public administration is how you allocate. You never have enough resources, how you allocate them. Just looking at some of the numbers, one of the areas in Dublin, crimes per 100,000 people is about 10 times, over 10 times what it is in one of the best rural areas. And yet the proportion of guards doesn't match that ratio. There are more guards, but not proportionately as much. So just to get a sense from you is how you go about the business of deciding who goes where. And probably, if you're starting from scratch, you wouldn't put your resources where they are. How you get from where you are to what you regard as the optimal allocation of your scarce resources is a challenge. Just try and get some understanding of how you approach that and what are the criteria that drive your decision making in this area.
There are a number of factors, but even the very point you raised in terms of comparison between urban and rural, there's also what we set out to do as an organisation, and part of that is reassurance to rural communities in terms of a community policing response. And for that, then you need to have a workforce of numerical strength which can cover expansive rural areas. So that in part drives those numbers. So it's not just about crime, population number also will drive it, but also then you can have distinct factors within a district. Here there's a big influx of commuters into the tech industry, and also then students as well. So student population and tourist population as well can drive the considerations, as well as then particular factors. So in part the prison locally has an element of driving resource allocation to here. So there's a science to it, but at the end, in part, there's also an art. But the other thing we have to be sure of is, over the last 5-10 years, our demand has changed and is changing, and the service that is required of us to work with other partners and to provide a service is also changing in its character as well, and will change looking into the future as well. There's going to be more in terms of community safety. We have to be available to our partners, be it statutory or be it non-statutory. So that's an extra element to this. So at the moment, we're really coming out of the very difficult period of recruitment around COVID and picking up momentum around our own recruitment again, and that's very positive. And we obviously have government sanction out to 15,000. Given population growth over the next 10 to 15 years, that's not sufficient. And so when we get to 15,000, the question will be, what is the next figure? I think that we want to make a business case for in terms of the size of the organisation. But new demands and our response to them have happened as well. So the district protective service units are an example of that. The new bureau we created around cybercrime and the expansion of resources regionally in that area, another element of that. The resources that we put into economic crime and fraud are another example. So there's just constantly areas where there's more required of us, and that does suck in a lot of the growth. And we've taken on and developed units which 10, 15 years ago didn't exist. The Armed Support Unit would be another example of that as well. So, and in part the Armed Support Unit is a response to just the critical and difficult incidents that we're constantly now responding to, and so that we can respond to them in a manner which is human rights compliant as well. Armed Response Unit is all about human rights compliance. So these things just create a huge sort of complexity around this. The good thing is we're a growing organisation, and in effect a rising tide will lift all ships. Yeah. And so, but we're just at the turn of the tide at the moment. I'm waiting for resources in effect to come online. We've had good success around the interest in the organisation, and indeed on Monday next, I think we're at 89 will enter Templemore. So that's positive, and just in terms of just our next intake, and then to further grow those intakes into 2023.
Yeah, except that it would be it's much easier to reallocate incremental resources to sort of growth areas where you want to go, but sometimes that can be a bit slow. It's a real challenge, it seems to me, to be able to take resources from a relatively low priority area and try and divert them. So to what extent are you able to do that? Or maybe you don't want to do it.
Only that there's a lot of churn in the organisation between just people wanting transfers, promotions, and even indeed cessations and retirements. And if an area there's a depletion of resources, actually it can be quite quickly achieved within an effect without leaving bleeding stumps everywhere. Just natural movement in the organisation. There's very considerable movement every year, and one only has to be a little patient, and you'll get to where you want, whilst building up another resource as well. And it is a big organisation, but even to expand any unit, you have to identify the personnel and necessary skills, and then build those skills up through their training, and then further then their expertise. So these things are we can't turn on a sixpence given the scale of the organisation, but at the same time, if we set out with here are the important areas for us. They're driven by the policing plan, and that's then what we have to staff, and in effect then the policing plan drives the staffing model then in behind it.
Okay. Just a final one. I looked at, when I see the numbers, I see fraud is up 43%. It's a new. We've all got these messages. To what extent would you like to give or repeat some of the advice around that to avoid that? And the second bit of it is, when it happens, are there any prospects of recovery? Once. If I'm defrauded, is that it? You can report it and you can try and catch somebody, but can I get my money back? Or do I have to be more careful at the start so it doesn't happen in the first place? Is that the...
Well, I think there's a number of things to say. These attempts at frauds that come at us and everybody, I think, through a variety of routes, be it text message or email or phone call or whatever it might be, and also then so there's this in effect scattergun effect to pick up the single or a couple of victims who may fall for the fraud that's been perpetrated. But the banks are very clear about what their communication is, and if you have any doubt, then just cut the communication and contact your bank or financial institution. I think one of the really insidious frauds throughout the pandemic was around both investment fraud and so-called romance fraud. And it has to be said, you can't have any form of relationship with somebody you haven't met, and not a relationship in fact where you're being asked to hand over at times tens of thousands of euro of savings or being asked to borrow money, etc. And it's just simply, even stepping back, you can't have a relationship with somebody you've actually not even physically seen or seen online either. So there's just that warning to people that these fraudsters, they have a whole patter, they've worked out what they have to do, and they're very clever in how they wheedle their way into people's trust. We certainly saw a spike of that during COVID, but that has relented somewhat since. And it is always then, you know, if you feel you've been the subject of fraud, report it immediately, because certainly we have had experience of being able to retrieve some of the money. It's rare, I don't even think it's, not sure it's ever happened, that we've been able to retrieve all of the money, but we have had success in retrieving good proportions of the money, and in part that's built on the relationship that our Economic Crime Bureau have with the banking system, but also then our relationship then with other international partners in Europol and Interpol, and our ability then to interdict, you know, where the money in effect, you know, is queued up in the line, waiting to move on to the next place. And in part that's why we're putting liaison officers out to the Middle East and to the Far East as well, so we can further develop that. And so please report, and report as quickly as possible to give us the best chance, and yourself the best chance, of getting some of the funds back.
Okay. Thanks very much. That's very.
Another comment just about fraud there, because the point to notice is that the organised criminal gangs behind fraud are highly agile. So one trend that we've seen in fraud over the last couple of months has been an increase in accommodation fraud. So as people are more vulnerable, as there's more pressure on the rental system, that's something that we've seen grow quite considerably, particularly with students returning to college. That's something to watch out for. As the Commissioner said, don't expect to have a relationship with somebody that you haven't met, and likewise don't expect to hand over money for accommodation that you've never actually seen and haven't met the landlord. Thanks.
Okay. Thank you very much. That's all from me.
Thank you. I can't remember who it was. It was a superintendent I heard saying on the radio there the day before yesterday, you wouldn't give €100 to somebody who said, I have something around the corner that I'll bring over to you in a minute. So it was a very clear and precise illustration of the caution that's needed. We are coming to the end. I just wanted to say a number of things. The first was, I think it has been very evident to me certainly over the last 7 years of the authority's existence, of the increasing extent to which the changing nature of the demand on policing is increasingly a key input into the policy making in the Garda Síochána. Not that it wasn't there before, but one sees the greater extent to which it's there. The second thing was that Andrew said that the nature of crime is changing, true, and the nature of the media is changing, referring back to the Commissioner's point, and the nature of information itself is changing. And I'm not sure that any of us have fully internalised the implications of that for a whole range of things. I want, first of all, to thank you, Commissioner, and the colleagues, to thank Chief Superintendent Scanlon and his colleagues for the hospitality yesterday and for the openness in the engagement which we had with them. To wish you well in April when you moved to pastures new. And to thank the colleagues for all of the work that was done in the engagement with organisations and community groups in advance of the meeting and the earlier discussions with Chief Superintendent Scanlon and his colleagues here in arranging this. It's an important part of our wish to get a clearer, a more broad-based sense of the issues and the reality and the dynamics of policing in different parts of the country, and it is a really important contribution to that. And at the October meeting, I omitted to give the usual anticipatory good wishes to former AC Mick Finn as he was about to depart. So I want to correct that, and now that he has embarked being the right word, on new engagements, we just want to record that for the record. So thank you, Commissioner, and thank you to the colleagues on both sides of the table. The meeting is now closed.
Flute, that's too decent.
No, don't. Thank you. Jesus Christ.
very concise to the point.
Yeah.
And,
I couldn't let away with that shite about domestic violence.
right, yeah, 100%.
Long goodbye.